And if you ask them to do high intensity training or intensive training, how many of them will accept that? Straight away start with the HIIT training. Will they accept? I don't think so. So I think it is this particular type of exercise only for persons who are into exercise, for doing already exercise. And if you ask them to do HIIT, they can do. And they are time bound, not for all. Okay. So I directly go into the facts and studies. So I've done already almost 15 trials taking almost more than 20,000 population, and it clearly shows that 150 minutes of exercise per week that actually correlates or transforms into A1C reduction, and this moderate to severe intensive training but not HIIT training. And particularly these are two types of short duration and long duration. Short duration would go into that may this anaerobic exercise like sprinting and weightlifting, and long durations like marathon running or long runs, cycling, swimming or dancing, whatever you want. And it has to go as per the patient's liking or whatever he feels like. We cannot ask him to do a particular type of exercise or this you have to do. We cannot ask them. So the key points is that studies show that all these studies they have shown that a regular structured exercise training, especially when exerting more than 150 minutes per week, can significantly lower the A1C value. Combining both aerobic and anaerobic, this yields a much better result as compared to any one of them done alone. And as for cardiovascular benefits, like regular moderate intensity exercise has been shown to significantly enhance the cardiovascular fitness and leading to improved heart function and blood flow. Also, it has got endothelial benefits like promotes better endothelial function, and the process by which blood flow dilates and constricts, and that improves or reduces the cardiovascular diseases. So I've done like many longitudinal studies. They also says that the duration of exercise that actually gives a better result, providing the A1C reduction, and they demonstrate significant association between prolonged exercise sessions and reduced A1C levels as an indicator of blood sugar control. And also the American Heart Association, they also endorse the same thing to start at least 150 minutes of moderate intensity aerobic exercise per week for adults or 75 minutes of vigorous training exercise for the young adults can contribute in reducing the blood glucose and the body weight and overall cardiac health. Also benefits the regular structured exercise plan that is more important. We cannot ask somebody to do straight away. It has to be structured and individualized. So how does it does it? It has got enhanced insulin sensitivity, like exercise duration promotes the long-term improvements in insulin sensitivity along with better glucose uptake by the cells. Mitochondrial biogenesis is prolonged physical activity stimulates the production of new mitochondria, enhancing cellular energy production and glucose utilization. And glycogen depletion and utilization. So sustained exercise depletes the glycogen stores, and that leads to increased and reliance on the fat for energy loss. Also, it has got like CNS benefit to with the prolonged exercise, like low intensity training for 35 minutes, so the 3 to 5 days. That also got the short-term benefits, also long-term benefits, and the benefits like increased brain health, improved mood, and increased brain structure, brain function, and brain circulation as well. So how does it how it does the prolonged how its prolonged exercise is actually helpful in reducing or increasing insulin sensitivity? It increases the GLUT4 transporters actually. So prolonged exercise promotes the upregulation of glucose transport, enhancing insulin sensitivity and glucose uptake. And regular exercise also improves glucose uptake by the skeletal muscles and facilitating the better blood glucose control. So this already it has been explained like insulin sensitivity, mitochondrial function, and reduce inflammation. This one more aspect is with the chronic prolonged exercise, that is reduction in the inflammation. So that also helps in improving the cardiovascular health. So even it has got something to do with the gut health. Research says that the moderate duration exercise typically consists of more than 150 minutes per week is beneficial for gut health, with studies showing that this amount of physical activity can significantly increase the diversity and richness of gut microbiota, whereas the HIIT training or with high intensity that have a very negative impact on the gut health, increasing inflammation and damage of the intestinal lining. Okay, let's say the benefits of the long duration exercise on the musculoskeletal benefits in the type 2 diabetes. So with the regular exercise training, it increase muscle mass, muscle size, and even it has got on the benefits on for the weight bearing joints and growth and help in prevent osteoporosis. The joint health is improved and posture and balance is also improved. So variety is the key. We can ask somebody to do one type of exercise alone. So we can strength, we can ask them to do for longer duration of strength training exercise or endurance training, flexibility, balance. So these all are important. So even the original studies have shown that now there is decrease in risk of hypoglycemia with the prolonged exercise duration, whereas with short duration exercise, there are always chance of getting hypoglycemia. So duration exercise is inversely proportional to the risk of hypoglycemia in for the longer durations. So how does it happen in the hypoglycemia risk reduction? So duration's protective effect is that prolonged exercises gradually deplete the glucose stores, reducing the risk of the sudden severe hypoglycemia. And there is also gradual glucose utilization. So excellent walks promote a more controlled and a gradual decline in blood sugar levels and improved also glucose regulation. So regular longer duration exercise controlled to a better overall glucose control, minimizing the risk of hypoglycemia. So I've already explained about the cardiovascular fitness, weight management, also muscle mass with also the longer duration of this strength training exercises. So that also, if you do it for a longer duration, that is beneficial. So physical benefits like cardiovascular fitness and endothelial function improvement. Also, there is with a regular physical activity of a longer duration, we can expect a good like body composition, weight loss, and trimmed body with a regular duration of exercise. Whereas we cannot expect that with a short durations or heat training. Okay, the potential limitations of heat training is that it can place high stress on joints and muscles, potential leading to injuries, and particularly in individuals with pre-existing conditions. Adherence is always a challenge, but the demanding nature of it can make it very difficult to some individuals to maintain consistent participation, leading to inconsistent results. And also cardiovascular strain is there. It can place significant strain on the cardiovascular system, which may not be appropriate for individuals with heat underlying heat conditions. So adherence is a challenge. I said high intensity, time commitment, and the risk of injury. And always it has to be, the exercise has to be personalized. Gradual progression is always important. Start slowly. Maybe you can ask for to start with the walk of 5 minutes and gradually improve to 10, 15, 30 minutes of 1 hour. And variety of activity is the key. With one exercise, you cannot, one should doesn't fit all. So personal plan, social support, if you do in a group, it's always better because they support each other and push each other. And also like, the gadgets, they are helpful, like smart watches or phones. They keep a track of what you do yesterday or day for yesterday, or compete with one, compete with yourself. And also there is mood, quality of life is better with a prolonged exercise because if you do it regularly, see everything, it has to be like if you don't fix a time to do it, okay, and if you're not like disciplined, you can't do anything. Heat training is that if you don't get time, you get time here, there, today morning, tomorrow evening, tomorrow night time, and do something. So that is not discipline. We cannot, put it in a regular lifestyle. It has to be in a regular lifestyle, and it has to be disciplined and planned. Like, you wake up in the morning, go to, brushing or whatever, then keep 1 hour for there in the morning, or not possible, keep it in the evening. It has to be fixed, routine. So multidisciplinary collaboration is again integrated approach, personalized recommendations, improved this patient outcome with this. Again, the scope of research is individualized exercise regimens, promote sustained duration, and invested long-term benefits. So finally, the things that actually put or keeps the duration as a priority is improved insulin sensitivity, though it's same with both. Better glucose control, of course, increased caloric expenditure, enhanced cardiovascular benefit, and improved muscular endurance. Also, good weight loss with a gradual or long-term exercise. Or the things that go against the intensity is increased risk of injury, limited accessibility, short-term benefits, very less studies or insufficient evidence is there, and may exacerbate hypoglycemia. Thank you, and now I rest my case on the lawn injuries.